Hello everyone. So today our case of discussion is case number 539 of medicine. A 62-year-old retired school teacher has persistently raised BP of 160 over 105 mmHg. He is overweight and has hyperlipidemia but has no evidence of ischemic heart disease. He has early symptoms of prostatism, and the most suitable initial antihypertensive for this patient would be alpha ACE inhibitor, beta alpha blockers, Charlie beta blockers, and delta diuretics. I'm going to give you 5 seconds so that you can answer this question. Yes, you got it right. The answer is B, alpha blockers. So let's discuss why this is the answer. So our answer is beta alpha blockers, and why this is the answer, because alpha blockers like dexazosine, prazosin, terazosin, these kind of drugs who have zosine in their end are all alpha blockers, and they have effect on lowering the BP and also help relieving prostatic symptoms by relaxing the smooth muscles of prostate and bladder neck. So our patient and plus has antihypertensive properties that is written here also. So alpha blockers are so special drugs that they have two actions, one on the prostate and other on the BP. So whenever the patient is presenting with no other complaints like ischemic heart disease or any kind of these symptoms history, so we will give this kind of patient alpha blockers for prostate plus lowering the BP. So this is our drug of choice here. Let's discuss why not the other options are correct. So ACE inhibitors, if the patient had diabetes, heart failure and proteinuria, these are the indication for adding ACE inhibitors or giving the ACE inhibitor at first. And beta blocker, if the patient has ischemic heart diseases or tachyarrhythmias, these kind of symptoms or diseases are best addressed by beta blockers, and diuretics are used in heart failure and volume overloads. So this patient has no other symptoms, only he has prostatism in his early stages and hypertension, so alpha blocker was our best drug. Let's discuss some other kind of question that will appear in future. If asked about first line treatment for hypertension in diabetic patient, the answer is ACE inhibitor because they have renoprotective effect. Okay, and if asked about first line antihypertensive in the patient with BPH and no and has no contraindications, the answer is alpha blocker. This is our question, today's question. If asked about antihypertensive that worsen erectile dysfunction, the answer is beta blockers and diuretics. So a patient who has who is young and has erectile dysfunction, so we avoid these kind of drugs in them because this will worsen their symptom if they have a history of erectile dysfunction. And if asked about antihypertensive contraindicated in bilateral renal artery stenosis, the answer is ACE inhibitor and AR base. So I told you in the first point that ACE inhibitor has renoprotective effect. So we have to go in the mechanism of ACE inhibitor, then we will find out that this has effect on renal arteries. So we have to avoid these drugs when we see bilateral renal artery stenosis because this can worsen the patient's outcome. Okay, so other than that, ACE inhibitor are best for diabetic and with the patient having such like patient of ischemic heart disease and arrhythmias, we will do beta blockers, and patient with volume overload, we will go with diuretics. Okay, so here the best answer is alpha blockers. Thank you so much for your attention. Please subscribe to our channel for more content like this, sword of knowledge on the YouTube. Thank you so much.